I'm hearing from you that acupuncture, and I've personally experienced it, is very effective because it kind of unblocks the chi, it moves blood.
So, we recognize endometriosis, but really in TCM, which was formulated thousands of years ago, there was no terminology called endometriosis, but it falls into Tongking, which means like painful menstruation. But endometriosis, as you know, is not just about painful menstruation, right?
Yeah.
So like we can't totally equate, right? Mm-hmm. We can't, what's the word I'm thinking of? It's not like endometriosis equals this in Chinese medicine, because we can't, because we look at different things and we look at the body differently. So yes, we recognize it. It's like, oh, okay, because of endometriosis, then we'll look towards these kinds of syndromes, like, the blood and energy stagnation and blood stasis, because due more to cold, blood stasis more due to heat, which is like causing congealing and contraction of energy. And then there's a combined state of like phlegm and blood stagnation. Right. So the words used are very different than Western, but it equates to inflammatory response. And so, I mean, in Chinese medicine, we don't necessarily say blood stagnation equals endometriosis or endometriosis equals that. There is the interconnection for sure, but it's not one equals the other. And it's beneficial when people come to us with a endometriosis, but it's certainly not required. And that's why when people will say, oh, should I wait till I get my diagnosis before I get treatment? It's like, no, absolutely not. Because let's look at, what is going on both in your physical body, your emotional body, your mental body. All of it is what gives us a picture from a TCM diagnostic point of view, rather than getting a Western diagnosis. Am I clear on that? Do I need to?
Yeah, certainly. You're basically saying when a patient shows up, it's not essential. It's helpful that they have a diagnosis of endometriosis, but there are so many other findings that might lead to the diagnosis yourself. In practice, you might be the one to diagnose them, and then they can maybe confirm it. Either way, the treatment will be the same.
That's right.
Whether or not you have the official diagnosis, the Western diagnosis, because it's showing up as blood stasis or liver qi stagnation, which are TCM or traditional Chinese medicine diagnoses. And you're kind of just uncovering that and then addressing them from the physical, and in addition to the mental, emotional side of things, because you're treating the organ system and the blocks within that organ system. You're not just saying you have endometriosis and it's a cookie cutter diagnosis, and then, we're going to treat you all the same.
Exactly.
Everybody's different.
That's right. Because even and you see this and I see this, and women experience it may see this as well. It's like, even if you read it in the books, this is what you may have. Well, you might not actually have those symptoms. And so how do we treat that from a holistic point of view, where we do look at you in all aspects of you? Again, physically, and physically we may look at, your menstrual cycle, which is a big telltale sign, right?
Mm-hmm. And what are some of the signs? Tell me, what would you expect to see, let's say, in pulse and tongue for a woman who has the kind of standard endometriosis kind of picture, perhaps? And then what are you looking at in her menstrual cycle, perhaps like blood appearances and levels of pain and regularity and all that?
This is where I wish I brought Kim Heng, one of our associates, because when he was in China dispensing herbs, he was in the gynecology department, and he would tell me that women would bring their menstrual pads and show the blood, because
that's so fascinating.
The color, the consistency, the volume, the quality, all gives us signs of what is going on. Like, for example, if you have like chunks of blood on your menstrual pad, then yes, that is definitely signs of blood stagnation, like very highly visible, right?
And tell me what stagnation is for people who maybe aren't as familiar with TCM diagnoses.
Yeah, that's a really great question. So what is stagnation? And from a Merriam dictionary point of view, it's like the non-movement. it gets stuck. Well, what causes things to get stuck? If you go out, well, let's look at a stream, right? If the stream freezes over, it gets stuck, it does not move. That's called stagnation. And that's cold stagnation, literally. There are terminologies we use that. And then so, or think about if you're cooking something on the stove and you cook and cook and cook, and then it becomes like nothing. All the fluids have left it, and you're left with like this burnt stuff. Doesn't look very good, certainly not tasty, but that's stagnated stuff. It coagulated to the point of there's no movement because there's no fluid left in. And what we know now, again, integrating with science and what we know in science, we know that all of our cells bathe in liquid, right? Our bodies mimic the earth, which is about 70% water. So it really should behave that way. So when we look at anatomy books, it's static. We see pictures, but in reality, our whole reproductive organ area or, internal organs technically are like bathing in an ocean. So there should be slight movements. And so when there is more coagulation, more phlegm stagnation, more blood that gets congealed, then literally it creates stagnation, non-movement. And that non-movement can cause pain. Hence, when women will say like, when I have my period, I have this great pain, but then when I release and I see a blood clot, it's like, oh, I actually felt better after the blood clot in menstruation. So that is truly blood stagnation at its peak, right? So some women don't see blood clots, but they still may experience pain. Sometimes it's in this local area, like it doesn't move. It's always in the same spot. And that is another sign of blood stagnation. Chi stagnation is slightly different. It hasn't congealed to the point where it's completely consolidated. Chi, there's some flow and movement with, so the pain can be more transient. It can actually change in locations. So it's not to it's like a less severe scenario. Right?
Okay, so definitely the congealed blood could be a sign, or the stasis, and then pain varies. And what might you find in a Chinese medicine pulse? Like, what are you looking for, when you're assessing the wrist?
Yeah, very good. So one of the standard, when we talk about gold standard for endometriosis, like looking at through a laparoscopy, right? Dr. Sharma discussed this in our last episode, right? So we talked a whole lot about the Western side of it. But guess what? This Western modern medicine is only a couple of 100 years old. So what did we do prior to this, which is now documented about 3,000 years old, but really we think it's about 5,000 years old, and it has evolved and it's just such a mature art and science, right? So let me bring it back to then how we assess. So we look at the actual symptoms. We look at through palpation. So literally palpating, feeling the abdomen, the tonicity. If you're actually feeling lumps and bumps, there's some stagnation there, right? And then there's the gold standard, if you will, would be looking at the pulse, what you just mentioned, and the tongue, right? So the tongue, depending on the kind of stagnation, right? The tongue could be actually quite really crimson red, but maybe towards like a duskier crimson red. And so then we say it's like probably like through that dampness congealed through heat. Now, if it's really pale and also still has that dusky tinge, then we say, oh, this stagnation is due to cold. And I myself, like if I felt like a little bloated, during menstruation when I had it, it actually felt really good. Like, so if you're a person who craves heat when you get your period, right, that tends to show that likely there's more of like that stagnation, and it's more due to cold, and it may respond to heat and movement, right?
Right. And are there particular temperatures you would recommend, let's say for a woman who has the classic kind of symptomology of menstrual pains? with her period, and maybe she's suffering a lot with, nausea and bloating and a lot of tension. And maybe she has to take Advil every 4 hours, until her period's done. And you're trying to limit that so she doesn't get, stomach ulcers and gastritis. What would you recommend for somebody in that scenario, temperature wise, maybe acupuncture and even nutrition from a properties perspective?
Yes, those are all really great questions, and we can spend a day on it. So we're just going to do a little
top threes or twos, one each.
So, I mean, in terms of treatment, right? Like in the West, have a pain, you take a pill in that moment. So coming from TCM perspective, it's like, let's actually be proactive. And why wait for the pain? Why don't we treat you before the pain comes so that perhaps you don't have pain at all? So I'm going to give you an example. I had a patient who was an endometriosis patient, and I treated her for fertility, but I don't even want to talk about her. What I want to talk about is one of her children, so she finally conceived, and now one of them is early teens, and her whole little menstrual life, she had severe pain to the point where she couldn't go to school. And then she remembered, she's like, oh my gosh, I did acupuncture for fertility. It's like, why can't I use it for my kid? So she came back with her kid. And I'll tell you, within 2 sessions, actually within the very first one, she didn't have pain. She could go to school. First time in her life. And where she didn't have to take anything either. Right? First time.
Yeah,
so being proactive is key. And so I've seen her a bunch of months, like literally 1, maybe 2 sessions initially prior to menses. And that was enough to stop the pain altogether. And then it actually helped to regulate her cycle. And now she doesn't really have pain. And if she does, it's like totally manageable. She doesn't miss school anymore. It is so cool. Right? And really, cool. It is so cool. And what are the differences? So number one, what do we know about acupuncture? It helps to move the blood. When you do Doppler ultrasounds on the abdomen after acupuncture session, it literally doubles. So it physically moves the blood. And that's necessary because I just mentioned, like, some women get like this old blood that stays and stagnates, and like we need to get it out. So it's like, let's get it out throughout the cycle. And then it, doesn't leave you with inflammation, doesn't allow the pain to ensue, right? And then, of course, what else is part of it? Because TCM is not just acupuncture. TCM is your lifestyle. And coming from a Eastern perspective, even though this kid is considered like highly full of Jing essence, right? She's like new to life. This is her beginning. She's had her period for a couple of years only. So she's in the beginning. And so you're considered more yang, more action, more movement, more hot. So, but even still with that kind of stagnation, sometimes warmth moves and allows for movement, kind of like a stream, back to the stream, right? So what helps that? Physical heat, physical movement. Because she is energetic and she is young. So for her, it's like movement is in fact very, very important. For another kind of endo, if they're like really deficient, we might need to bolster up energy so that there's enough energy there for movement to be there too. Does that make sense? Like, I don't.
And in that case, I mean, that would be somebody who maybe, during the actual menstrual cycle is deficient, and you would kind of have them pause, rest, but perhaps movement leading up to unblock that stagnation, right?
Exactly. That's really well put. That's exactly what we will do. And, for those of you who do not know, Tanya is a naturopathic doctor, but she actually has extra training with acupuncture too. So she knows her stuff.
Thank you. And I was actually going to point out, because I heard you say ultrasounds and then change the topic. And I've seen in the literature that ultrasounds before and after acupuncture shows increased blood flow to the ovaries and the uterus. So that actual, the theoretical moves blood. Well, it really physically does, which is physically quite fascinating.
Yes. Yeah, it's amazing, right? So, and thankfully now there's more interest in acupuncture. There's over 15,000 research articles. So if anybody says to you, like, if you want to try acupuncture, just know that it is now very well researched. And in the last 10 years or so, there's even more prevalence on research for gynecological issues. And, obviously, well, no, not obviously to others, but obvious to me, there's a lot of interest with regards to acupuncture and fertility. But prior to, it was more acupuncture for pain of any kind. And isn't that important now? Because we're speaking to reproductive organs and pain now, all in one shot, right? So we do see an impact for sure. And so if you have endo, or even if you don't have the diagnosis, if you're experiencing pain, this modality is very helpful. I never make any guarantees, but I'll tell you, I see profound differences in people's lives, which I just mentioned, this little, I shouldn't call her little. She's way taller than me, but she's
younger.
This young adult. This youth. Oh my goodness. This youth, right? And it's transformed her life and her confidence.
Yeah. And in women in general too, like younger women who are, like myself, when I went through my stages of, painful periods and got diagnosed with endometriosis, it was miraculous to me that I could do acupuncture once or twice a month and then not flatline, because I would flatline and I would throw up, I would get cold. And that was kind of when I learned all about the properties and keeping my feet warm and using, hot water bottle on my abdomen. Yes. I was told not to use like the electrical one, like, because the property of water, or even like hot compresses. Yeah. So tell me more about that.
No, I love this, right? Because again, it's not just about acupuncture. It's like your lifestyle. And so that is how you even cover up. I don't know what this trend is right now. Is it to bare your middle? Do people still, I think that's come back in, like showing your middle, right? And in TCM, it's like, no, don't show your middle. Like you have to protect your kidneys. We say that rules of reproductive organs. Like, so you actually want it covered.
Kidneys are in your lower back, but energetically, if you've got cold wind on that area and you're wearing a shirt, like a crop top, that's exposing that area, then what?
Yeah. So then that's actually not good. It's now this external pathogenic influence that will impact your internal nature, which is already predisposed, right? Because you're already not liking the cold, and, just to look good for vanity's sake or to keep up with trends, you're wearing the nice outfit, but it's not good for your reproductive organs or your endometriosis, if that's what you have. So we always say, when we are saying, give us like some top tips, that is like a very practical tip that anyone can do. So even if you have like those short crop tops, sorry guys, like wear super, super high, and that's in now too, actually, right? The high-waisted stuff. So then there's no separation. Like don't have your skin showing. The other place that we lose heat is through our feet, and the opening point to the kidney meridian, kidney 1, is actually at the bottom of the feet. So it's like, even if you're in your home, please wear socks. I've had this conversation with you actually, because you like to not wear socks. I'm like, wear socks or slippers. Oh yay, you've got something on your feet.
I know it's electrical, but I can't keep it warm if it's hot water bottle. So I wear socks and a heating pad, and you were so kind to buy me like warm wool socks for Christmas time. So I was like, oh, it's so sweet. You're right. I need to keep my feet warm, but you're right. It makes such a huge difference. And, it's funny, just to step away from gynecological health in general, there used to be that old midwives' tale that if you get, they say old midwives' tale, where if you get a cold wind at the back of your neck when you're outside, you're going to catch a cold, or if you go out with wet hair. Yes. And can you speak to that? Because it's not really a midwives' tale. It's actually a real thing. And I personally experienced catching colds when my neck was getting a cold wind exposed to it when I was younger. So tell me about that.
Awesome.
Just briefly, I know that we're not really talking about this, but
No, but these are
to
external.
give an explanation.
Yes.
Right.
Yes. And in fact, in Chinese medicine, we actually say, you need to keep your neck covered as well, because basically you're going to live like with all parts covered. Okay. Sorry, guys. I'm not sorry. But
No,
sexy doesn't matter. It doesn't necessarily mean you have to have your body like unveiled. Okay. Like sexy can still be wearing a turtleneck. I swear.
And it depends on the temperature outside, of course. Yes. We're talking like cold and wet and rainy. Yeah. You're walking out there with wet hair and no neck warmer, then
and like, again, it's individually dependent. So you know yourself. So I'm speaking to you who is watching, who is listening to this. You know yourself. You can tell me, like, if I ask you, are you a person that gets cold? And you'll say, oh my gosh, yes, all the time, right? Or not. So if you're the person that says, oh gosh, I get cold very easily, then you're definitely the person that I would say, cover your neck, especially if there's any exposure of wind, even in the summertime, like have like a little cute scarf, right? Like just at the back of the neck. And it's true. Like we actually say this external pernicious influence grabs you by the neck, right? And when it's covered, it's like the screen that protects your body. And if we think of it from a scientific point of view, even when viruses want to come in and enter, they come to the most available place, right? So through our mucous membranes, through our nose, through our mouth, open orifices. But guess what? Pores on our skin. Still part of it.
Yeah. And we're covered with viruses and bacteria. In fact, if I always say to patients, like if we took away our skin, our bones, our tissue, and we just saw Mary made up of viruses and bacteria, I'd still see your outline because that's how many we have. Yes, right. But if we we're pushing the, wind gates in the neck, and we're just throwing wind at it for a person who's sensitive, then it weakens the immune system. From a Western perspective, it would weaken the immune system. And then you'd be more likely for your body as the host to be taken over by one of those viruses.
Yes.
I never thought about it from the pore perspective though, like just infiltrating, right?
Well, it is infiltrating. And then what do we think of? Okay. We have armies of immune cells. And where do they rise? They rise up through your blood capillaries. And where is the most distal? Where's the most superficial? The blood capillaries just underneath the skin. So all your little white blood cells come out to the surface to fight. And then you throw this wind at it. It's like, oh my gosh, you're blowing them away. So they're not doing its job as well. I'm just creating this visual, making this analogy right now, but I think it makes sense, right?
It does. Yeah. It's like, it's rediverting. It's kind of like if I say in labor, when you're in labor, if you're in fight, flight, freeze, fear mode, then all your blood circulation is going away from the area that needs it, which is your uterus. So you can channel that energy to labor, like to birth your baby. So it's like trying to keep your energy in rather than giving it out to your periphery. And in this case, it's like you're being attacked by wind, essentially.
Yes.
And it's like,
so this is a great diversion because I'm going to tie it back in. So I remember some women will say, about the whole dietary piece, right? Because we like warmth. So which includes warm food, warm drinks. But I've had some people challenge me and say, but Mary, I'm overweight or I have a higher BMI. And wouldn't that be a great way? Like drinking cold water, that means because I'm like, no, we want to treat your body so kindly so that it doesn't require extra energy. When you take your drink, you don't have to heat it up. Then your body is more efficient at doing what is necessary. Like if you're trying to conceive, then your energy is better well spent going to where it wants to go versus taking time out, heat up the water that you're taking in to body temperature, and then you assimilate it. But the perspective is, but that means that will challenge my metabolism so that I will burn more calories if I have to heat it up. But it's a wrong thinking because going back to where do we want the energy to go? We don't want it to go into our stomach. We want it to go to our reproductive organs.
Correct. Yes, right? Exactly. And then we also don't want all the energy. That's why we say soups and stews, right? easy to break down, assimilate, absorb, and less, energy into the spleen stomach. And don't you find that a lot of women with endometriosis will have spleen qi deficiency, and so they'll have loose stool? In Chinese medicine, that's spleen and stomach are paired organs, so you've got to kind of keep those organs healthy. And you don't want to be diverting with cold foods. You want like easy to assimilate foods so that your digestion is good, you're absorbing your nutrients, and then potentially less loose stools around the period and less pain with the period. And it's interesting because in the literature, and we'll talk more about this in a future episode about what to eat specifically from, I guess, a naturopathic perspective integrated in with TCM perspective, but dairy has been said in some literature it's not so good for endometriosis, and some it says it is. And I think it's a matter of finding your individual, inflammatory or properties of food, not just inflammatory, the food properties that trigger you. Because people talk often about the proteins or inflammation, but what about you as an individual? What triggers you to have loose stool and or constipation, for example? And
and that's a really great point too, because here's the thing, it comes from China, and so Chinese in general did not have dairy. I think I'm not going to say across the board, but a lot of us can't digest dairy products to begin with. And then I will also argue that, well, it's not an argument, but a lot of people in general don't digest dairy very well.
And we should have a whole dairy episode.
Okay. All right. So we'll leave it
fully into that.
Yes. Right. So again, in general, it's true. To TCM point of view, it's like, let's just not have dairy at all. But that's very black and white. And I do see, if you're like coming from a background, a cultural background that has been doing it for thousands of years, and you actually can digest it, maybe you have a slightly better advantage.
Yeah,
but I would still
bacteria makeup
and different bacteria. Yes,
different
of
genes,
course.
different bacteria makeup. Yeah.
But still, going back to like what TCM is, it's about balance. So it's not like, oh, I can digest, so now I'm going to have it at every single meal. Like anything, right? Anything in excess is just not good.
I am that person. I'm always trying to find my balance. I will overdo something that tastes really good and then learn the hard way. But yes, it's finding balance 100%.
And so even like with the soy dilemma, like it's like, do I have soy? Do I not have soy? Is it bad? Is it estrogenic? Is it not? So again, coming from the place of balance, it's like, it's fine if you have it at a decent dose. But if you're having so some vegans will have like tofu, like till their cows come home.
Right.
Even though they don't eat cows.
Interestingly, because it's considered kind of a plant estrogen, right? In isoflavones in soy. But interestingly, soy itself is considered amphoteric, which means that if your estrogen's low, it'll support you a little more.
Yes,
and if it's high, it brings it down. So it itself, as long as you're eating it in balance, not every day, 3 times a day, it will actually help you to balance your estrogen.
Exactly. So I don't think we need to completely shy away from or just go hard out and like do it all crazy, right? So it's everything in moderation is much more healthy, period.
Yes.
So we only have a couple of minutes left because we want to keep this tight. And our topic is endometriosis and we divert and it's all good.
So to summarize from a TCM perspective, I'm hearing from you that acupuncture, and I've personally experienced it, is very effective because it kind of unblocks the qi, it moves blood. And then interestingly, there's many different ways to kind of diagnose it from a TCM perspective, from looking at your types of menstrual bleeding, pulse and tongue. Like, have you ever looked at your tongue and wondered what it really means? And a lot of people do. They stare in the mirror and they wonder. And you can actually look at all different areas of your body, like your temperature, your menstrual cycle regularity, the blood, and then come up with a diagnosis and treat. You don't need necessarily Western diagnosis, although we are very complementary. We are not, we don't believe in alternative medicine. We were talking about that with Dr. Sharma in the last episode, where she talks about how to diagnose this endometriosis from a Western perspective. And we don't need you to be a hero. So if you are suffering from menstrual pain that is ridiculously intense, or just perhaps your pain threshold is low and it's really harsh for you, then NSAIDs or anti-inflammatories can be very good. But being
And it can work.
proactive, and it can be very
Yeah.
helpful. Yes. Being proactive to try to lessen the amount so that you don't then get the consequences of using too many NSAIDs or ibuprofen for the pain is the better way to go, because you don't want to get a gastritis or ulcers. And in addition to acupuncture, there are things that you can do, like staying warm, keeping your feet warm and your abdomen warm, and dressing in a way when it's, appropriate for the temperature, and then understanding your body and seeing somebody like Mary or anyone alive for that matter, acupuncturists in general, find somebody local to you to help you so that you can get an understanding and be more in tune with your body, understanding of yourself, and find the right nutrition for you, because really nutrition, lifestyle, and temperature, it matters.
Yes. And we will go more deeply into that as well, because yes, there's acupuncture, there's like the temperatures and all that. And we're going to speak with you again about lifestyle stuff like food, what to eat, because we didn't go deeply into that. Yeah. And then even like herbal medicine. So Chinese herbal medicine is very famous for gynecological issues, which includes painful menstruation or endometriosis, stuff like that, adenomyosis. Again, beyond what we're going to talk about today, but like we can just unveil so much, right? Unpack so much. We're going to be at some point interviewing Dr. Burns out of New York, and she's a Chinese herbalist as well. I would love to also bring in Kim Heng as well, our live herbalist, just to like pack those kinds of things in, because we're just here to educate you so that you can make your way, make the choices that work for you, right? And that's what it's about, because not everybody can schlep to get acupuncture or afford treatments all the time. So this is something that we've created so that you have really good and reliable resources and education so that you can make informed choice for your life. So just to add to what we've been talking about, we've been talking about tongues. And so I would love to challenge everyone that is listening, watching, to take a picture, not through the selfie mode, but through the camera, a quick picture in front of a bright window so that it's natural lighting, and send it to us at
myfertology, myfertology.com. At gmail.com, sorry.
At gmail.com.
Myfertology at gmail.com.
Yeah, send it to us, because we want to make it a little collage. And then send it out as a mass to show how wide and varied we are as individuals, like snowflakes we had mentioned, right? Like our tongues are like snowflakes. They're all different. And so do that. And then the other piece I want to add in is about the pulse does reflect also our inner status. And it's comes from China, pulse taking. But in the West, we've adapted it as the rate and rhythm. But in Chinese medicine, we look beyond the quantitative analysis, but we also look at it qualitatively. How does it feel under the pulse? And for an endometriosis person, then we look at it more as a choppy pulse. And there's so much more nuance that goes along with it. But the primary thing, we look for choppiness.
Awesome. And we can, jump into a whole other episode on tongue and pulse. We'll do a nice little quick one on that too for patients, because if they find that fascinating, I totally find it fascinating. Then we'll do that. How's that?
Yeah, and reach out to us, email us or DM us on at myfertology to let us know what you want to hear. And if you want to hear that, please reach out. Okay, let us know so that we can do this. So if you like this episode, if you learned something, please share it with everyone you know, because you never know who may need this information. Thank you.